So that is very, very important, that we should not guilt trip. Means as doctors, we should not guilt trip our patients. We should not tell that it was your mistake, you did not bring the patient to hospital at a proper time, you did not give consent at a proper time. Because suppose I am a villager and I have my own wife having blood clot in the brain, I will think 100 times. I will have to consult my own relatives. I'll have to, maybe I may take second opinion, and because it's a big thing, no, brain surgery is a big thing. I may take 3 to 4 hours, or maybe I may take 6 hours. If I am not aware of the subject, I am a layman, I will take. So when I put myself in the shoes of the patient husband or patient's relatives, I will come to know that the delay is inevitable. The delay is inevitable. Nobody can take a frank decision within minutes when it comes to brain, when it comes to heart, when it comes to some big surgery which needs to be done. What do you say, Monica?
What is the role of patients, sir, in avoiding guilt trip towards doctor?
Yeah, definitely. So I am being very self-critical. I am being very critical about our own colleagues and all. Yeah, definitely. Patients also guilt trip doctors. And my humble request, if this video goes to people, doctors also, like I think 50% of the solution I have given, 50% is coming from the patient side. So I have humble request to all the patients who are listening to this and who understand English. Maybe we will create the same content in other languages also, because this is very, very important. Please do not guilt trip your doctors. Please do not criminalize your doctors. The moment this criminalization or guilt tripping of the doctor happens, doctor will go into defense mechanism. Doctor will not be able to give their 100% because of the fear which is created. So instead of telling that you did not do your job well, you killed my patient, or you damaged my patient. See, the diseases are not given by doctors. The illness is not given by doctors. It is part and parcel of our aging process or our existence as human beings. So if you tell that diabetes was given by the doctor, I am extremely sorry. Diabetes is not given by a doctor. Hypertension is not given by a doctor. A cardiac issue is not given by a doctor. Blood clot in the brain is not given by a doctor. All these things are natural phenomenon. Sometimes we ourselves are partially responsible for that through our irregular daily activities, through our irregular diet, through our irregular sleep, through our irregular management of stress. Okay? Or else we are prone to infections, we are not maintaining proper public hygiene. So many things are there. Okay? So doctors generally are there to help you, are to save you. No doctor will go into the surgical theater or in the OT thinking that I want to damage this patient, or thinking that my patient should die. No doctor is going to think like that. So please humbly understand that every doctor who is taking care of your patient is trying to save your patient. And there are sometimes issues which happen which lead to patient complications which are not deliberate. They are generally because the situations are so critical. Specifically in brain and spine, situations are very critical. So my humble request from the as a doctor to the patients and their relatives is, please do not make your doctor feel guilty. Please make him or her feel comfortable. Like, okay, sir, we understand that there is a problem, there is issue. Now, can you please do your best, and can you please help us out in this situation? That will open up the doctor, that will make him feel comfortable. And it is not your only one patient. There are so many other patients which doctor is taking care of. So what is going to happen? That his mindset will be free to take care of the other patients as well. And he will or she will not be under stress thinking that, oh, what is going to happen. Your kind words will help the doctor to serve you and other patients well. So what do you say, Monica?
Yes, sir. Absolutely correct, sir.
Do you think neurosurgery is far more challenging than other super specialties?
Yes, sir. Most of the complications are related to brain and spine. It is the most danger area, like complications may occur.
Yes.
It is most challenging branch, I think, sir.
It is, I think that it humbles you. Most arrogant of the arrogant people can become humble when
Yes.
they are with neurosurgery.
Neurosurgery.
Okay, and I think that there is a lot of spirituality in neurosurgery. We can understand the subtle aspects of human existence. We can understand that there are very few things which are in our control. Even if we are disciplined, even if we have done our best, sometimes there is something called destiny, prarabdha, which determines the outcome. It is a very humbling branch, and that is why in the NEET super specialty this year 110 people, initial 110 people did not take neurosurgery. It was the 111th rank that took neurosurgery. That shows that people are thinking twice before taking neurosurgery. And that I think patients' relatives also should understand that when we are dealing with brain and spine, it's going to be critical. It's going to be unpredictable in many senses. Even if everything is ticked right, things may go wrong. Thank you, Monica. You are a very composed resident, and you and Tarun, both of you tackled the situation very, very well. And I am very happy to have students like you. And I am very happy to have patients, relatives who are quite understanding, and they know the gravity of situation. They are correlating their previous experiences, and they are understanding the fragility of human existence, and they have supported us well.
Thank you, sir.
Thank you, Monica.